70 staff within a week that were out.
These healthcare workers were among the first to battle a COVID-19 outbreak in America. Few in the United States have more experience with the deadly toll it took. How quickly do you see the demise of someone with COVID-19?
Less than 24 hours.
They work at Care Center of Kirkland, the nursing home where the first known U.S. cluster of COVID-19 deaths and infections occurred. For a month, they have been treating and continue to treat coronavirus-infected patients. Have any of you had symptoms of the novel coronavirus?
No.
Have any of you tested positive for COVID-19? For weeks, this was the location of the most deaths from the novel coronavirus in the United States. This is the first time their story of what happened inside has been told.
If you Google signs and symptoms of coronavirus, it's runny nose, fever, and cough. I haven't seen a runny nose yet. What I see is much different than that. I saw what I described as red eyes.
I'd never heard of red eyes before. Why is that? Is that information just not gotten out to the public?
It's something that I witnessed in all of them. And they have like, you can describe it like allergy eyes. The white part of your eye is not red. It's more like they have red eyeshadow on the outside of their eyes. But we've had patients that just had the red eyes as the only symptom that we saw and go to the hospital and pass away in the hospital.
As of now, the CDC does not list red eyes as a symptom of COVID-19. Chelsea Ernest is a registered nurse and the nursing director at another Care Center facility in Washington State, and that is what she saw. When an urgent call for help came from the Kirkland facility, she volunteered. She arrived one day after the staff learned a patient tested positive for coronavirus. Why did you answer the call? You didn't have to be there. This was voluntary.
Well, I'm a nurse, and they're not my patients, but hold on, I'm sorry.
It's okay, take a breath. Ernest and her fellow staff members saw the death toll rise like a rocket. The terrifyingly fast deterioration of the patients always seemed to happen on the night shift, her shift.
That's how I describe it. It's you're going off to war and you're in a battlefield where supplies are limited. The help is slow to get to you, and there's lots of casualties.
And you can't see the enemy.
And you can't see the enemy.
Suddenly, a third of the staff had symptoms and was out sick. Before they all knew it, the virus was sweeping through the entire building. It was the oldest patients who were dying fast.
The average age was 80 years old.
Nancy Butner is the Vice President of Care Centers of America, Northwest Division.
Just the patients losing them. Because we live with them for so long, and it's hard.
After 2 days of madness, things seemed to calm, but not for long.
There was a little lull, and I heard a cough, and so I started following the coughs.
According to the CDC and Care Center, at the height of infections, 129 people linked to this nursing home tested positive. 3/4 of the patients, about a third of the staff, and 14 visitors. 29 people associated with this facility have died due to coronavirus. In the weeks that followed, the CDC came out with a report on the facility. It found in part the facility's limitations in effective infection control and prevention, and staff members working in multiple facilities contributed to the spread of the virus, both inside the facility and out.
Many nursing staff work in one or more facilities.
Do you think that will change, the idea of having people work at different facilities after COVID-19?
I don't know that it would. It's, you know, and again, in healthcare you work in different settings.
If everyone was trained on infection control, how is it that so many patients got COVID-19 and so many members of the staff also got COVID-19?
There's usually 2 patients to a room, and some of the rooms are bigger and they have 3 patients. And you have caregiving staff that are very close to their residents. And we hug them, we kiss them, we love them. And I couldn't have been perfect on my PPE process.
Saying wearing the personal protection equipment, You couldn't have been perfect because things were happening so fast. You were trying to save lives. She arrived after the first person tested positive. It took 5 days to get the results. Frightened families were outside, furious.
Who is they so we can follow up with it?
They couldn't get information on their loved ones for days.
We just could not answer the phone quick enough. We had a significant drop in staff. We had significant care needs that were a priority over, unfortunately, talking to families on the phone.
In those first few days, the Life Care Center said they made a cry for help to government agencies from county to federal to state. Did you get what you need when you needed it?
No.
No one was doing just one job. Stephanie Booth is in charge of payroll.
I worked in the kitchen. I don't know, I've done a little bit of everything. I did some housekeeping.
Everyone was doing everything until doctors and nurses arrived from the Centers for Disease Control and Prevention and Health and Human Services. The number of patients in the facility has dropped now from 120 to 42. Of those 42 patients, 31 have tested positive for novel coronavirus. What advice would you give other facilities, other doctors and nurses, other staff members about dealing with COVID-19?
I didn't expect it to be so lethal. And I have no shame in saying that I was wrong.
Anderson Chelsea Ernest says she was wrong about thinking that the coronavirus is kind of like the flu. She does not think that anymore, and they do admit as a staff that they did make some mistakes, but they say they were the first in America to battle this new virus.
Yeah.
Anderson.
And just a reminder of all those nurses and doctors out there right now risking their lives. Sir Seidner, thank you very much. Up next,
Yeah.
men